Now we're going to review the basic functionality of the HFT 150. When you first power up the device, you'll see that it starts in standby mode, which is noted in green at the top here. When you hit the power button one time, it will go into therapy mode, which you'll see in blue. Whenever you, before you apply the high flow therapy to the patient, you always want to make sure you're getting the flow from the end of the circuit here. I'm going to put it back in standby. While it's in standby, we can adjust all the settings before we apply the therapy to the patient. If you see here, we can adjust the FiO2 by just touching it, scrolling to where we need to be, touching it again. Same with flow. We could also depress the button a second time to confirm. Same with temperature, 31 to 37. If you look here in the top corner, you'll see the battery icon. Right now, the battery is charging and the light is blinking. When the battery is fully charged, the light will be solid. Also, we have adult 1 next to the battery. So you can set up two different setting profiles. Perhaps one when your patient is being transported or walking, and the other while the patient is in bed. So I'll depress, and you'll see when I go to adult 2, we have a different range of settings programmed. I'll go back to adult 1, press to confirm. And as you can see, we're in standby, and I will press the power button to start therapy. I'll check the flow and then apply the interface to the patient. The HFT 150 comes with a rolling stand, a cart that carries 2 oxygen tanks. I'll show you here, there's a brake on each side as well. One big feature of the HFT 150 is the ease of mobility and getting mobile to get your patients out of bed. The things that facilitate this are, of course, this cart as well as the battery. The integrated battery will last in excess of 30 minutes even at maximum settings. Despite that, we want to make sure that we always plug the unit in even at the transport destination, whether it be CT or X-ray. Even if it only takes a few minutes, we would like to encourage you to keep the unit plugged in at all times when possible, and also between patient use. As well, as you might know, the high flow therapy as a device is pretty high demand for oxygen at high FiO2 settings. So we always want to start every transport with 2 fresh tanks and stay aware of our pressure. So just as a recap, some of the features of the HFT 150 that I'm the most excited about is just the ease of use and intuitive settings on the front of the unit. This will make it very seamless to integrate this device within your hospital and facilitate the training for both nursing and respiratory care practitioners. The other feature is the ease of mobility and transport within the hospital, with the incorporated battery, as well as the rolling stand and e-cylinder carrying capacity. The last thing I want to mention is the ease of turnaround. This unit can be turned around right within your own clinical setting, right on the patient floor, with just the disposables kit and a wipe down with an approved disinfectant wipe. So thank you all for watching the HFT 150 quick setup video.